Hey, it's Clay at CPAP My Way and CPAPMyWay.com. Today, just wanted to take a little bit of time to run through the provider menu on the DreamStation 2 with you. We've had so many of our customers receiving DreamStation 2s specifically in exchange for their DreamStation 1s. And the common question we're getting is, are my settings correct? So one way to find that out is if you've got it linked up in Care Orchestrator, or it's got the ability to stream the information through cell or Wi-Fi. Your provider can look in and make sure everything's set correctly for you. But if you don't have that ability, you could use this information to pop in there real quick and just make certain that your settings are what they're supposed to be. In this kind of video, I just want to caution you, if you're not a clinician or under the advice of clinician, do not make settings adjustments. This is a prescription therapy settings that you're going to be looking at here. So I'm here to show you how to look at them and make sure they're right. But it's not one of those things you want to willy-nilly around with, because you could certainly affect your overall health if you're not careful with it.
All right, so accessing the clinical menu is pretty simple, but you got to know what you're doing. I recommend taking one finger anyway, press and hold that button until it starts pulsing, and then with your other hand, swipe down on the screen. You are now in the clinical therapy settings. So the first thing you'll see in your provider menu is what mode your CPAP is in. That will typically either be auto or CPAP. To adjust that, you can click on the mode and switch between the settings. When you switch it to auto, you have a min pressure and a max pressure. When you have it in CPAP mode, obviously it's just one fixed pressure. If you scroll on down, you get your flex setting, which is your exhalation relief. That can be adjusted from 0 to 3. Tube type, which can be adjusted from 12 to 22 millimeter. Ramp time, which is where you will set your minimum pressure and the amount of time you want it to take to get to the therapy pressure. This is where a lot of people are going to have some, are going to want to see here. This is your patient controls. So we've had a ton of people say, hey, I can't see all the data that is on your report on my machine. Well, that's because probably your patient controls and your patient data are turned off. So if you get to patient access and patient controls are off, right, so this is everything that it allows the user to control. So if it's off, you will not have control over those things within your patient level menu. To enable it, all you have to do is go in here and turn it on. Same for the patient data. That's on the little data report that you get on the patient level menu. If it's on, you will get all the detailed data like AHI and things like that. The options here are Easy Start. So Easy Start is just a less aggressive algorithm. So it'll take a lot longer to increase pressure for new CPAP users. For a lot of our old school users, they're not big fans of the Easy Start because they're already used to the pressure. So for most old school people, I would recommend leaving that off. Your mask type is adjustable between off and then X1 through X5. Those settings are actually found on the packaging of your Philips mask. If you're not using a Philips mask, you'd have to convert that, but you could also just turn it off. All right, and then coming along the bottom, you've got your data menu here, right, which will just show you average usage and all the good stuff you should be able to see on the patient end as well. And then in device, you get your ability to do a device reset. Don't touch that. Your language, your time, and then of course how many hours are on your machine, your serial number, software, all the really useless information, but the information about your machine. Once you've gone through the menu, or at any point, once you've changed the desired setting, just hit exit, and it'll ask if you really want to exit. You press yes, and you are now back in the patient level menu. So hope that helps.